Hello, Assalamualaikum. Welcome to another episode of Clinical Pharmacist Life. Uh, Today, I would be discussing about new services known as medication management, medication therapy management services. Just a background on that thing. Uh, when the pharmacist was given an initial opportunity to become a clinical, the very first terminology that came up to the limelight or was coined was pharmaceutical care services. That was suggested by Helper, H. Helper in 1990s, around 1991, and then clinical pharmacy. The term clinical pharmacy services was quoted. The issue with the clinical pharmacy word was that it was very much related to inpatient pharmacy rather than outpatient pharmacy. But now, within this whole 2 decades, the pharmacist role has been defined not only in the hospital but community pharmacy also as a clinical healthcare provider. Hence, a new terminology has been introduced that is known as medication therapy management services. With This is a services that include all the clinical roles that we know of a clinical pharmacist. But yes, as a consultant, as a person who is providing that services, it's not a part of the job, it's an extra one, and for which it is for which the farmers is being paid, at least in America it is being paid for. And Recently, a new board certification that is known as National Board Certification of Medication Therapy Management has been introduced. That is again one was introduced. It is very similar to Board of Pharmaceutical Specialists that include BCPS in then boards of specialization in ID and cardio and oncology. It's very similar to that. Yes, now few of I've been asked a question regarding this certification, whether they should go for this certification or not. I have done this certification. I and another young lad from Pakistan who has done this certification at this time. But I did not feel that this certification has given me an added value because it is at a very initial stage, and might be because that I have already have a master's degree in clinical pharmacy. So having a board certification would not add on my resume or per se on that particular one. Uh, yes, at this time nowadays in Pakistan and in many of the Arab countries, uh, BPS is a board pharmaceutical specialist is much more recognizable and much more acceptable credential for clinical pharmacists rather than this particular National Board of Medication Therapy Management Services at this time. But yes, it will grow in future. But anyone who wish to do it and would have the patience that it will benefit in future, not at this current time. So I would recommend if someone wants to do a board certification, go for BPS now. As soon as this certification, BCMT, MTMS, will become recognizable easily, then people should go for that thing. I hope I have answered the queries. Thank you very much.